So with me now is Ellen. So Ellen has been with us. How long have you been with us now?
That's 9 months. Roughly, yes,
really been
9 months now.
So Ellen works from our Brighton clinic. You're there most Mondays.
Yep.
We just thought we're going to do a bit of recording so that when patients look on the website, they can actually meet you before they meet you, if that makes sense. Yeah. And I think it helps patients to actually formulate their questions if they know a bit more about your background. So in terms of, obviously, what brought you to us, what skill set and what made you click on that apply button?
I think for me, mainly, it was when I read the job advertisement and it said women's health, which is something I've always had an interest in, but also being nurse-led. And making a difference to women, being able to offer a service for women that's not easily accessible for women. But my background is kind of sexual health and contraception, and I've been doing that for about 10 years. Yes, which I absolutely love. But I've always had a passion for women's health and making a difference to women, particularly.
Now, how are you finding it at Brighton?
Yes, I'm enjoying it. I really do love it doesn't feel like a job. It really doesn't. It doesn't, just because it makes such a difference to so many women, and sometimes it is life-changing for a lot of the women. You come back, they can now go to the gym again, they can go and run, or they can go out and walk their dog without feeling really sore and irritated for days after. So it has made such a difference to a lot of women.
Is it what you expected it would be when you started?
I didn't really know what to expect because it is so new. It's coming out of a very different environment that I'm used to. And you are the sole, although we've got the support of everybody, you are that sole practitioner there. And I didn't really know what to expect. But actually it's kind of exceeded my expectations without realising, just because of how positive all the feedback is.
Well, I think also it's quite good because we've got such a diverse skill set between the nurses, so urology, gynae, midwifery, sexual health. Yeah. It's quite nice, although we are sort of working alone, but we are part of a team. And we have our regular meetings that we do online as sort of a monthly get-together. But the reason we're obviously talking today, we're not in Brighton, clearly, is because we're having a network event. And it's the first one that I think a lot of you have been to. We've certainly not been able to do it because of COVID, but is what we're expecting from this, and is it anywhere near it?
Yep, even more so, because it's a lot of learning. It's nice to meet everybody in person rather than through a screen, and learn a lot from each other, and like you say, utilise all our skills. But kind of the people that we're having coming to talk as well, it really does make you kind of look at your practice and how you can kind of expand your skills and bring that in.
It's good, and also I think sometimes we forget that there's an even wider team. So there's people sitting behind the camera, there's people sitting at the end of the phone, there's people being supportive in terms of we spoke to our gynaecologist today, and there's a lot of new services that are coming out. So we're looking particularly from the aesthetic side. We're about to start some training with yourself, but we're looking at possibly looking at the Botox and filler side, but also the chemical peels, the mesotherapy, we're using the CO2 for resurfacing. So we've got quite a busy year.
Yes,
really busy year.
Very busy.
So there's all those sort of things to look forward to as well. But one of the other things we wanted to do is in the lockdown, we had a face-to-face Zoom session. So we've got our workplace women's health in the workplace projects where we're recording different sessions for people to tap into and whatnot. But what we wanted to recreate was the online ones, where a bit like our Connect meetings, where we have 1 hour once a month and a practitioner will come along and talk about a subject, which we'll record so other ladies can share it, and then have a bit of a Q&A session, which actually some of our patients ran them. So Sarah, who you've met today, she ran one on menopause and sex post-cancer, that sort of thing, and it just opens the floodgates a bit. So in terms of subjects, is there anything that you particularly think you would like to present or share, or anything you feel specialist in?
I think kind of what's normal for women in terms of discharge, kind of local hygiene, common abnormalities such as bacterial vaginosis, things that affect women quite a lot, and actually what they can be doing to manage that themselves. Because that's what we see a lot in my work, and contraception, giving a lot more information to women so they have that informed choice, which is that's what I enjoy about this job, is you have the time to talk to women, give them the chance for their voice to be heard, and tailor the care to them as an individual.
Well, I think the other strength of our company particularly is that all of the nurses work in their specialist areas. So I remember last night, obviously we were talking over dinner, but there was one of the nurses that was asking you about certain types of contraception. I was like, oh, that's quite new, I didn't know that. Yeah. So it's, again, sharing that knowledge, because you're still on the front line, but also bringing those skill sets in a different, very similar but very different sort of way, but then also supporting the colleagues. It's quite a nice, happy family, isn't it?
It is. I don't think a lot of people don't realise what the options are for them.
They don't.
And I think even if you don't work in a particular area, even as a healthcare professional, you don't, things change all the time. So if we don't know, then patients aren't going to know, women aren't going to know. And it's having that time to share that information with them and with each other, so we can support each other.
Problem is, the more we learn, the more we need to do.
Yes, well, yes.
That's good. And we get lots of positive patient feedback as well. Patients love coming to the clinic, and often a lot of the feedback isn't just about the treatment, it's about the care that the nurses give, and the fact that we are nurse-led, and we've all been on the receiving end of most of the treatments.
Yes, we have. We have indeed.